I'm here, guys. How are you? Good afternoon. Haven't seen you for a long time. Well, I've been uploading some old videos recently. Anyway, welcome back to my channel, Philippine Nurse Retires Home. And if you have not subscribed yet, could you please do that? Okay, I only have about 57, striving very hard to be in the level of those big ones. No, it would be very long before I get there. I hope I would not retire from this work. But anyway, so subscribe, hit that red button on your the right corner. Subscribe, comment, share, and like or dislike. But the most important thing is you're gonna view my channel, okay? You view it, the whole thing at one time. I mean, one at a time, view it. So anyway, today I'm gonna discuss about the nursing routine as a mother, okay? So that this is actually intended for those who are interested to come or to go to United States or in Western world. How the mother nurse keep up with working at the same time as a mother, working as a nurse. Okay, that's all what I know, nursing. And this setting here is ICU because that's all what I know best, okay? All right, the shifting here in United States is 7A to 7P, that's day shift, and 7P to 7A, that is night shift. So I'm gonna go over with you the routine on day shift, okay? That's what I know best also, but I worked night shift before. All right, the routine is, supposing you have one baby and she's still a baby, you know, you're gonna start at home, wake up at 4:30 in the morning, or maybe 4:30 to 5 o'clock. It depends on your distance from the hospital. Since in my case, I have to drive at least about 35 to 45 minutes away from the hospital. So I have to have a little bit more preparation. Now, so you wake up at 4:30 to 5, you have a quick breakfast maybe and prepare that, maybe fry eggs and then toast. Or that's all you can do. You cannot be sophisticated with your food, okay? Or maybe a little bit oatmeal, and you eat so fast, and you prepare something for your husband also. All right, now you take a good shower and then put a little makeup. You don't want to look like pale and look like crap, okay? You want to be presentable to your patients and to your co-workers, okay? That's what they want you to do, okay? And clean clothes. So put a little makeup, put a color on your face, okay? That's what I'm trying to tell you. All right, get the baby ready. Make sure he has or she has diapers, baby food, milk, okay? And put them in one bag and go directly to your car and then drive. In my case, I have to drive the other way, 30 minutes, and go to my babysitter, give all the instructions, and I head to work, 30 more minutes. So that's about an hour for me actually. My husband, most of the time, he does not do it because our babysitter is near the hospital, nearer for me. All right, now when you get to the hospital at 6:45, you have to clock in. And clock in, or sometimes at 7 exact, or 5 minutes before 7 o'clock, you clock in, okay? Then you go to work, and then you take report. Maybe, I would say the report, it depends on the acuity of the patients, because this is ICU, maybe a little longer, 5 to 15 minutes, something like that. 5 minutes really is so short. Then after that, you get your MAR and your patient's care summary. By the way, you're gonna get your assignment first. Normally you have 1, 2, or 3. It depends on the acuity of your patients, okay? When they are on a ventilator, you normally have only 2. But they're gonna be on different kinds of drugs, drips, and CVVH. That's kind of dialysis. then you're gonna have a one-on-one. It depends, balloon pump, whatever. It depends on how many lines you have, how many ventilators, and what is the status of the patient, if they are unstable or not stable. It depends. So the charge nurse would determine that. Normally, you will have a chance to be a charge nurse. Okay, you will have a chance, especially if you are an RN. Okay, not all people can do charge, but they want to rotate that charge position. Okay, so you can be a charge. You don't have too much option there. And after you get all your MAR, you're gonna make your rounds, prioritize what you need, what patients are stable and non-stable, and stable and non-stable, and you're gonna have those. You're gonna see who needs the care immediately, who needs a stat medication or stat laboratory that you need to do immediately. The labs are usually done by nurses. Not a lot of lab techs would mess with lines. So since we have central lines and all those catheters you have, you can do that yourself and you can send it to the laboratory. We normally have tube system, that is a vacuum system that we can send all labs and all paperwork and all everything that you have all over the hospital immediately using that vacuum system. There's a transport system that we have all over the hospital. Okay, so you put it there, just like almost like a tube like that big, and you put all the labs there and you send it to the laboratory. It usually has different numbers in different departments. Okay, so that's a very good system. You don't have to go down unless if necessary. Okay, there's some laboratory works that you cannot send or you cannot send using the transport system. All right, so after you determine who needs medication stat, you're gonna look at all your meds, what are their schedule, 9 o'clock, 8 o'clock. So we have different kinds of timing, BID, QID, TID, and all those PRN medications. Now, so suppose if your patients are on ventilators, then you're gonna determine if they need suctioning and so on and so forth. Okay, now this is just a normal thing that nobody is dying or anything. Okay, this is a normal routine thing. Now at 4 o'clock normally we try to give all patients their care. You're going to be turning patients every 2 hours. So you have a nursing assistant, but sometimes you cannot really, you cannot rely on those people because normally you only have 1 or 2 and they're not sometimes very good in helping. Attitude is the problem. You will know that. I'm not going to say anything about anybody, okay? Race, color, and whatever. I'm not gonna say anything, but you're gonna know that, okay? Who are those that you do not want to work with, okay? So, if they're lazy, they're lazy, okay? That's one thing, regardless of the color of the skin, all right? Now, at 4 o'clock we start. I do normally get all the datas, or 4:30 or 5 o'clock, the datas like hemodynamic status of the patients, the hemodynamic profiles, INOs, and all those kind of stuff that you need for report, okay, vital signs. And we do our own blood sugars, by the way. And there's just still a lot of things that you would know, like titrate medications and so on and so forth. Now, your time, 12 hours, is not guaranteed in cases of emergencies because sometimes patients would die on you or patients get unstable and you have to do like start different drips from the very beginning, start lines, and assist the doctors any kind of like insertions of like intubations, insertions, central lines at bedside, so you will be there. Sometimes they code how many times and how many patients you have. I experienced like boom 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 codes. Basically it's left to right, you have codes, and you have to help also the other nurses. If they're tied up, you're gonna have to take over. You have to be a team player. You're not just gonna be sitting down there and not help. So they rely on you and you rely on them. So it's a team playing thing. I know it is a kind of it is a primary nursing. We do not it's a primary nursing. You have your own patients, but you have to be available there for them in case of emergency, and if in case they would ask you to do something for them, because it's a give and take thing. Okay, otherwise at 6:45 you're gonna start your report, and hopefully you can get out of there at 7:15, but most likely you cannot. Okay, especially in ICU, because you're gonna be rolling patients up and down for CAT scan and all those whole 9 yards. Okay, it's a hectic area to work at, but you only have lesser patients. But anyway, you're gonna get very good at it. Okay, it takes a while, but one day at a time. And then now after 7:15 you're gonna have to drive back to your babysitter, pick up the baby, and back to your house, and then cook supper. Or you probably can get you a takeout somewhere, and then after you eat with your husband, maybe watch maybe a little show, and then hit the bed at about 9 o'clock, hoping that you can go to bed straight up to 4:30 again. Oh, by the way, I did not tell you this. You have to prepare the baby's food. What I did before, I would have to prepare her food and put all her milk in a container and put it in the refrigerator, and I have to do cook her some porridge or anything like baby food, and grind them, put them in small containers, and put them in the refrigerator so that she will have something to eat. Okay, and prepare all her diapers, and that's already in one bag, and I'll just stick it in the refrigerator. And then at 4:30 and 5:30 you're gonna do it again over and over. During your day off, you're gonna have to wash your clothes and whatever, do some yard work maybe and all, and you fill up your days. Before you know it, you go back to work again. So vacationing, we can hardly take a vacation longer than 14 days. That's all that's allowed for you to do. But hopefully you're gonna enjoy life as a nurse, and somebody has to do the job. But anyway, you will get better, and that's only what I told you. It's only a normal day. Okay, normal day and one child. Anyway, and good luck to you, and I hope I was able to give you a little idea what a nurse job is, especially for a newbie, like newbies, okay, or or nurses who are just planning to go to United States. Thank you. Bye bye now. God bless.